Hi, can you see me? So, the reason I haven't uploaded in the past few weeks is because I didn't have quite enough content for videos every single day because there wasn't too much going on. Now I have a significant update, and I hope you find this interesting. The first thing I think I'll start with is the last thing you guys heard was day 3. Day 3 really sucked. It really, really sucked. The first time I unwrapped my leg, it was kind of horrifying because my knee was swollen so much, and I had all this like I had steri strips and all sorts of other things on my leg. I think if I edit this video, I'll insert a video right now. I really want to know if there's any like sutures underneath there. There's definitely not any staples, but I wonder about sutures.
Well, we can't take it apart.
Well, I know I'm not going to. I wonder if he's gonna take the strips off on the 7th. I kind of hope he does, because I want to know so badly. The curiosity's gonna melt my face off.
Melt your face off.
Yeah.
That's so sad. Okay, you can move your leg. I can't sit.
Well, I can't move my leg very far, because
What did you write on your leg?
I wrote words on my leg.
What does it say?
I'm not gonna tell you.
Bite me. Don't.
That can be arranged.
I don't know why we're changing these things. They're clean.
Well, I mean, I was sweating earlier, and I also really want to see what my knee looks like, so... But I don't know why they want us to change it every day. I'm not going to change it every day.
Because you can't take the stair strips off.
I'm not going to take the steri strips off. I want to, but I won't.
I know, but they said do not.
Wait. I want to hold this pointed at my knee. Yeah, just like that. So... Oh god, that's the weirdest thing.
Yeah.
Okay, look at my other knee. So this knee's like this. It's all like weird and bony. This knee is moved over here. It was over here.
It'll
Moved over here.
be fine.
I want to know where my scar is, because I had a scar like right here. I want to know where it went.
I don't know. They took it away.
They can't take it away unless they cut the skin off, which would be really... I guess I'll find out when I get all the stuff taken off. I really hope they also clean the iodine off, because I hate it. It's sticky and it won't come off. It's like iodine and then something else.
Okay, I have to have help here.
Okay. And that video is not of the first time that I unwrapped my leg, because I was honestly too scared to... It was really, really nerve-wracking. I wasn't sure how it was gonna go. But, yeah. So, the other thing. So I have the game ready, which I've started to use. I'm supposed to be using it 4 times a day, but honestly, it's been really hard to do that, because I'm supposed to use it for an hour each time, so that amounts to 4 hours a day. And then I have another machine called a CPM, continuous something rather movement. But I have a machine that is supposed to help me move my leg without using like my leg muscles, and it's supposed to like subtract from the gravity. Like, you know, if you bend your leg using your leg, like doing it yourself, it'll be a lot harder than if you had than if you like used your arm to bend your leg, which is something I wasn't as aware of before surgery, but I definitely am now. I graduated on June 1st, and I was in a wheelchair because there was just no way at that point, when it hadn't even been 2 weeks yet. It actually had been a week and 2 days at that, or a week and 3 days? A week and 2 days. It had been a week and 2 days at the point where I graduated. So I wasn't really up to using crutches that much yet. But I used a wheelchair. I could use crutches. I could, but it was really hard, and gravity was still like a lot for my leg. But I used a wheelchair, and it was fine, and it was great, and I'm really glad that I got that opportunity, because I started to think that I wouldn't be able to. As far as bending my knee, I'm at 50 degrees right now. and it feels really, really tight to bend my knee. And I don't know if that'll be the same for you guys that have gotten the same surgery, because all of my this wasn't like a one-time injury. Oh, we have to go in and reconstruct your MPFL because it's really dodgy. I've dislocated it over both of my patellas, but we started with the left one because it's just a little bit worse. Whoops. So we started with my left knee, and I've dislocated both my knees, well, each knee probably over 20 times since I was 13, and it's all of my connective tissue is a bit too stretchy. We have various thoughts on why that is. I think I mentioned that in another video, but yeah, so we had to do that, and because everything's overly stretchy, he put in the new ligament extra tight, so I think that's part of why it's so hard for me to bend it, but also because, I mean, it's a new ligament, so it'll probably be hard for any of you, but that might be why I'm having more difficulty. I'm not sure, because he did say that he put it in tighter than he would have normally. But honestly, you can go up like 5 degrees in a day as long as they have like a machine for you. If not, just listen to whatever your physical therapist tells you, because I guarantee you'll have one. If you don't, I'm sorry, good luck. That's another thing. I'm starting physical therapy in about 2 weeks, and I can take a shower now. I can take showers again, which is kind of scary. I took one sitting down last time, which was kind of a bad idea because I can't trust my other knee to help me get up because it dislocates as well. So I think I'll stand this time. I'm just really afraid of slipping, which is a legitimate concern regardless of whether or not I've just had surgery, because I used to take a lot of baths as well because I was afraid of slipping, even with non-post-op knees. It's just really nerve-wracking. I can't submerge it yet. I can take showers, I can get it wet, I can clean it, I can put like cream on it or something, because boy, let me tell you how dry my knee is right now. Also, it is a bit like, here, let me show you my knee. This is like what some of you've been waiting for, I'm sure. Ugh. I'm honestly like really surprised people are watching my videos. It's super flattering. I didn't think I was that interesting. But thank you. See, I don't have any bandages on anymore. It's much cooler. I think it's easier to bend now. See, I'm bending it right now. It's super weird though. I'm gonna be honest. Oh Christ, stop. Okay, there we go. So this thing here is a scar that I've had for over a year. This here is like, I'm not exactly sure what that bit was. It might have to do with the nerve block, not sure. That's just some pen marks, because you mark the human body before you cut into it or pierce it. This is one incision, and this is the other incision, and I think maybe I can feel the nails, or the screws. It's really weird, because there's like a lump here and a bit of a lump here, and I don't know what else that'd be. It might not be that, but it's kind of weird. And there's like a random spot here, you can see it might be kind of red. It's like really sore, and then from, see, like right here to here, so like that much of my knee is completely numb still. She said it's normal and it could last for up to a year, which I really hope it doesn't. But, I mean, it's not terrible, at least it's not in pain, although it is a bit, like, tender underneath, which I'm sure isn't all that unexpected. As far as what the ligament is, it is from a cadaver, and I have no problem with that. Some people do. My surgeon hesitated to say the word cadaver until I said it, because some people freak out, but I don't really care. It's fine. I don't know if you can see it, but like right here and right here, there's 2 little red dots, and then they're here and here on this incision. when he took all the steri strips off, because I wasn't allowed to do it myself, there were 2 pieces of, like, dissolvable stitch sticking out of my knee, which was super weird. And, I didn't know it, but they were just connected, like, under my skin. So, a nurse told me that he was going to pull, and then pull as far as he could, and then cut it off. So, like, some of it would be in my knee. But that's not what happened. He pulled the whole thing through, which did not hurt, by the way. It didn't hurt. It felt really weird. It's probably the weirdest thing I've ever felt in my life, and this is like, I can't feel this, although this is like bruised. So I've got like some areas I can't feel at all, some areas are hypersensitive. I mean, it's generally, it's not that bad. It's alright. It's not that bad. But yeah, that was the weirdest thing. It was bizarre, but my knee felt a lot better after he took all that stuff off. This right here is, actually, you know, it's really weird. My thigh is so floppy right now because I've lost the muscle mass, which really sucks, and I hate it, but I'll gain it back. So look at my 2 knees. This one isn't actually that swollen anymore. They're in different places. Like this one, you can see it moves around. This one, I'm not gonna try, but it also, well, oh god, it still does. But, I think that's because I don't have a trochlear groove. So that's part of the problem, but at least, my MPFL doesn't have that give anymore, so it probably won't dislocate. We can hope. But it's really weird, because you can, like, I can feel the little bit of a groove here, where, this patella sits a little bit over that groove, and then this one sits, more to the side this way. So if I show you, I can kind of see there's like a ridge here. That's my femur. Yeah, it's really weird. So, yeah, I've been putting vitamin E oil on it, to be honest, I kind of like scars, but I've been doing that because, my skin can get painfully dry, and I don't really want that. I'm not into it. I hate it. I'm gonna do like I'm probably gonna do a foot mask peel thing on my feet when I can reach them again. Yeah, so what else was there? I might upload a video from the pool when I go again. That would be kind of fun. As far as my videos go, regarding my knee, how do you want me to do those? Because I could do lots of different things. I'll definitely upload a video after I see my surgeon again in August, but I mean, that's a ways away. So what do you want me to do until then? I guess I could post a video every time there's like an update, but what kind of things are you interested in hearing, is my question. Oh, and one other thing, I don't know why I went back to my knee. One other thing, I don't know if the first week is horrible, but you do see an insane amount of improvement. I'm not even to week 3 yet, and I can walk pretty much without crutches. It's become pretty easy. I kind of have to swing my leg, but it gets easier. For me and my body quirks, my hips pop every single step I take, but I mean, they kind of did that before surgery too, because everything's hypermobile. But yeah, it doesn't hurt for me anymore. I've been trying to sleep on my stomach, because that's normally how I sleep, and it just feels better, but I would say to be careful with that, because you are putting pressure on your kneecap. That's something I forgot to ask about, but yeah. I don't think I have anything else to say. If you feel like I didn't cover something well enough, or if you have any questions, I do reply to every comment, because, I mean, there aren't that many, and it doesn't take too long, and I like doing that. I like to communicate. It's pretty cool. So, I'll do that. Sorry this video's so long. I hope you enjoyed it, though. I think I'm definitely gonna upload a video, filmed at the pool, because I think that's kind of a cool idea. And I get to show off my swim trunks. It's gonna be pretty cool. Alright, well, I hope you enjoyed this video. If there's any other kind of video you'd like to see, I do plan on uploading videos